when you search just the word postpartum, a lot of depression stuff comes up with it. But I don't like that, because to me, postpartum isn't just synonymous with mental health or depression. There's a reason as well why we see the rates climbing, not just in moms, but dads, to paternal postpartum depression, is because our view of postpartum itself is not really there. They're really, besides the clinical definition of 6 to 8 weeks after giving birth, there is no actual proper definition. To me, postpartum is interdisciplinary, it's cross-industry, it's mother-centered, family-focused. I realize the words kind of mean the same thing when we say centered and focused. At the end of the day, we know the mom and the child dyad is hand in hand. You can't separate that. And that's the nature of how our babies work as well. They just need mom. That's just the way it is.
Getting pregnant and giving birth are two of the most exciting things you can ever hope to experience in this life. The moment you think you could be pregnant, you're frantically searching for all the best information, which is why you're here today. I'm Stephanie King, and with my many years of experience as a professional childbirth educator, doula, and lover of all things pregnancy, birth, and postpartum, I'm here to make preparing for your birth enjoyable, empowering, and totally easy. Each week, I'll cover different topics, interview professionals, and get into the nitty-gritty birth stories from mamas just like you. And when you're ready for more, you can join me in the My Essential Birth course at myessentialbirth.com, where I take you step by step through exactly how to prepare your mind, body, spirit, and partner for a birth you love. So let's get started. All right, let's start with our reviewer of the week. So this week it is from Birthing in Bliss. And she says, water birth experience of my dreams after switching birth plans at 35 weeks pregnant. So thankful to stumble upon this inspiring podcast around 26 weeks pregnant while searching for info on the Fresh test. That episode became the first of many that I devoured during the last 14 weeks of my pregnancy. Listening to and internalizing all of the birth stories, and especially Stephanie's empowering explanations of unmedicated birth in the birthing course, emboldened me to switch my birth plans from the hospital where I had my first two babies to a birthing center at almost 35 weeks pregnant. I love that, you guys. That's so cool. I became hooked on the prenatal exercises and utilized the meditation tracks every morning, even making my own to relax with before and during labor. I had the labor and delivery experience of my dreams and was truly able to be present during every moment, enjoying the spa-like ambience of the birthing center, culminating in a beautiful water birth. Watching my previously skeptical physician husband fully shift his opinions as we experienced this magical birth together was one of the most rewarding moments of my life. I feel like that would be extremely rewarding. Yes. And let's talk about a podcast episode, by the way. She said, I owe so much to Stephanie for inspiring me to dream big and find my voice. Thank you for blessing me with your work. Thank you for that review. And how awesome is that? I absolutely love this. This is for you as well if you are listening, since I do not have a name, Birthing in Bliss. But today we're going to talk about postpartum. So I am excited for you guys to hear from Dr. Kristal Lau. So I'm going to take a moment, tell you a little about her, and then we'll kind of dive into today's episode. I think you guys are going to love it. Dr. Kristal Lau, a leading postpartum wellness consultant and former physician, is an award-winning author of Postpartum 30. She brings over 10 years of combined experience and knowledge in clinical medicine, scientific research, and public health, including her personal experience as an Asian expat in the West, a mom of two, and a U.S. military spouse. She delivers insights and actionable strategies for postpartum wellness, specializing in bridging traditions and cultural practices with modern postpartum care and lifestyle medicine. So you guys, Dr. Kristal Lau here with me. We have done this before. We have recorded this episode before. And we didn't have such luck with the way that it came out just because of Wi-Fi and some other technical difficulties. So benefit to you, we get to do this again, and hopefully it's going to be even just like that much more action-packed. But thank you for coming back and being here with me again. Will you take a moment and just say hi to everybody and maybe just a little snippet about personal life, and then let's get started.
Absolutely. Thank you, Stephanie. I'm really glad to be back. I think probably the last time we tried this was a good, what, at least 6 months or so. It's been
It's
a
been a
while.
while.
So, yeah. So, hey, everyone. Kristal here. And right now, I'm in France. So, my husband, he just retired from the military a few months ago. So, I think, Stephanie, when we were talking at the time, we were just getting packed up, getting everything ready to go. So, whirlwind. But right now, we're doing good. We are settled in France. The girls are going to a local public school. I am getting in and trying to learn the language and continuing all the work I'm doing, which we're in a good place. Probably take us a whole year or a bit more to get settled, but military life, this doesn't feel like any other PCS or kind of thing. So yeah, I'm excited to be here to talk to you again about all the topics.
Yes.
Yeah.
I'm excited to have you here. Yeah, this was a really interesting read. I will admit I have not been through it the entire way. But what I absolutely love about it is I do think it's this like perfect melding of you brought in the very best that you have from these cultural traditions, this Chinese medicine that you talk about, as well as our American medicine here and just how we treat the mom in postpartum. So actually, I'd love to hear kind of just a little bit of your background of your like where you come from and the traditions that are experienced there. I think where we get this a little bit confused and what I thought was super interesting about your read is, totally guilty of making these like, well, in this tradition, they do this. So we're doing things wrong here and not fully understanding the scope of what we're saying or what is done in another person's tradition. So will you kind of talk about your experience and what that looks like and how you brought that kind of modern for everyone?
Absolutely. So I am Malaysian, born and bred. I only left home in my 20s to finish medical school in Australia. So a lot of what I grew up with was we used a lot of, I guess you could call it modern medicine or allopathic medicine, together with Chinese medicine back in Asia, all parts of Asia pretty much. And what was interesting for me growing up there was this concept of postpartum rest or confinement, as we call it. So I am fourth generation Malaysian, and pretty much the Chinese language has kind of been lost a little bit due to, you know, at the time I was growing up, we were encouraged to mostly speak English. And in Malaysia, of course, we had Bahasa Malaysia. So those were the two languages you grew up with. And your mother tongue kind of gets a bit lost unless parents, grandparents, or you went to like a specific school that taught the language. So because of that, a lot of us, instead of saying 坐月子, which is the actual Mandarin term for this practice, we say confinement because everybody realizes mom is so-called confined at home for a month or 40 days, depending on your ethnicity as well as your family culture. Some people do 30 days, some people do 40 days. So it's interesting when people back home say, oh, you're going to do confinement. When I was first pregnant, I knew immediately what they meant. But then my more Western friends and my in-laws were like, confinement? They're like, what is that? Sounds like jail or something, which is interesting. But I do realize there is a shift when I say the West, it's not just in the US, but Australia, UK, and even here in Europe where I'm at, that the word confinement, we're using it a bit more to describe a specific, more cultural type practice of postpartum and kind of trying to distinguish that yes, confinement can be related to, incarceration, but also there is another meaning to it. And in this case, it's postpartum rest practice. So from my perspective, coming to the West and then being in Alabama when I had my first child and second child in Germany, I do have to change how I practiced it as well, because a lot of times in Asia, you would get the cultural practice kind of go hand in hand with Chinese medicine. Because when we think about this 坐月子 or the confinement practice, there is the roots in Chinese medicine there. And this is something that's also been documented in a lot of Chinese medicine texts. And also there's some historical texts that you get, I guess, translations. And of course, back in the ancient days with, across all civilizations, most of the people who had the ability to document all these practices in both the cultural aspect and the Chinese medicine aspect were pretty much scholars. Everyone in the villages who followed these things, didn't really know how to write them. So a lot of things are passed down by stories, word of mouth. And so that's why in my book, I do mention that there is a generic or general type of confinement practice that a lot of us in Asia grew up with and understood. But then there is also some concepts that are Chinese medicine follows Chinese medicine principles. And there is a distinguish between some practices that are more like superstition and taboo and actual Chinese medicine. And then because of the little nuances in each family, like for example, in China, my dad's side is Hokkien dialect, or the village is mostly they speak Hokkien and they follow a certain tradition as well. And my mom's side is more Hakka. And then you've got the Cantonese, the Teochew, and each family actually, or ethnic, sub-ethnic group, also has very specific practices around this time. I can't remember exactly, but I know one, a sub-ethnic group says you can't eat seafood during, your postpartum rest, your confinement. But then another family group says, you can and you should. So it's just these little bits and pieces that come into play, which I think is very unique. And this is where I think when you ask the question, in the West side and you're looking to more, say, Eastern traditions and it's something, say, you want to adapt in a Western context, you can't expect to do everything, I would say, perfectly, because there is such nuance even within the Asian cultures and ethnic groups itself. So what usually works, I would say, is for those who don't come from any of that type of heritage or culture, you can still participate. But of course, you do something more general, or rather, if you go and see a Chinese medicine doctor or you have friends, this is where I love the TV show Fresh Off the Boat, when Jessica pops over to her friend's house after she has a baby and says, I'm going to do the month for you and all of that. So if you have friends who are able to share that culture with you and, help you participate in that, then you kind of follow what they do. It's kind of also passing down the tradition, so to speak, from friend to things like that. So I don't see this as, how would I say this? I know sometimes there is a feeling of, like as an Asian person, I must protect this or something. I don't fully feel that, because the beauty for me, at least growing up in Malaysia, is we've been such a melting pot of, I guess, the Javanese back then who moved over to the Malaysia Peninsula. And then when the British obviously colonized us, they brought in the Chinese to come, the Indians to come and work. So we have really so many ethnicities in one small little peninsula that we share so many things. So for me, coming to the West and in the work I'm doing now, I'm just so open and so happy to share this and to invite, like, if you want to participate in this, by all means, we're here to help you understand it more and to help you perform the practice in a way that also makes sense with the modern lifestyle. So that's where my medical side, being brought up as, a modern, independent woman kind of thing, some traditions in this postpartum practice made me feel like I'm not comfortable following something so strict as well, because I didn't want my mom coming into my home as a grown adult to tell me what to do for 30 days. That was one thing. And certain things like you shouldn't wash your hair for 30 days or don't take a shower for 30 days. I was like, no, that's not something I'm going to follow, because understanding the public health advancements our civilization has made, it helped me see that some of these practices, and this is where I did try to dig for, as what we like to say, evidence-based today. I tried to dig in some articles or historical texts, and, frankly, a lot of them are in Mandarin. I can't read those things, but I could try to find some English translations, but there wasn't anything specific to explain why the practice was this way. Like, why were women told not to wash their hair or take a bath, take a shower after giving birth? But again, understanding how sanitation and cleanliness was like way back in the ancient days and what we have today, it made sense to advise new mothers in that first, after giving birth, everything's still healing. And back then, to be able to get clean water, it took a lot of effort and a lot of energy to even boil water. So thinking back, and that's why in my book I say it made sense to advise a lot of moms back in the ancient days to don't wash your hair, don't take a shower, and only drink teas and soups for 30 days because that was the best way to protect against the germs and all of the waterborne diseases, to be honest, because you avoid them. And if you always cooked soups and teas, you made sure that the concoction or the herbal drinks were boiled. So the water, is clean. And that's where I told my mom, no, I'm not going to not wash my hair for 30 days. But she insisted, and this is where that generational thing comes in as well. So I compromised with her. I said, fine, I'll just not wash my hair for 2 weeks. I said, but I will use dry shampoo because I can't deal with all the grease in my hair. And she said, fine. She added another layer. She's like, fine, but you must rinse yourself off with a ginger water. And that's not something that I found in Chinese medicine because I've asked my Chinese medicine physician friends. And that was a taboo that she believed in very strongly and was quite certain that if I didn't do it that way, I would have, fallen ill or not reaped the full benefits of the practice. So I said, okay, if you make them for me, I will use it in the bathroom. And she said, okay. So we compromised on that. And I think that's another aspect that's really important in this practice. Sometimes it's also about the elder or the generation before us. They participate in this so heavily, especially in Asia. Even my peers find it sometimes quite intrusive when their moms and mother-in-laws just show up and like bring everything and kind of move in with you for 30 days. But that's just a rite of motherhood. To me, that's that feeling of all the women coming together to support me or the new mom during the time, which is a very nice feeling. But at the same time, boundaries should be there for the comfort of all the parties involved under that one roof. And another thing in my book I definitely cover, because I did get requests when I first started asking the audience what were they looking for, was just to address this thing with the mother or mothers-in-law. How do we either include them or set boundaries? Because excluding them really isn't quite an option for a lot of families, because it's that comes to that cultural part and tradition part where they expect to be, and to tell them no is like pure disrespect for some families. And I think that's important for those of us who are in mixed heritage marriages or mixed race marriages, because then you kind of understand why my mother or mother-in-law wants to do this, and then you can decide what boundaries to set and how to collaborate and include them. So that's a big introduction, but passion topic of mine. So I could go on.
No, that was the perfect introduction. That's exactly what I was hoping that you would kind of like bring in all of that. I love it. I just love how you meld it together and how you speak about it. It makes so much sense to me. And so anyways, I just think it's such a service that you're doing to women in general, because we do want, as American women, like we do want to share those practices that we're hearing about that sound so wonderful with other people, and we want them shared with us and vice versa. And I think like, just like you talked about, like the motherhood and coming together, like as women who are having babies in general, it's such a beautiful thing to be able to do that, to share across all those different places and find the very best things that sound so good to us. And I also love that you're sharing for women who do have these cultural, families, whether they're mixed or not, or just how do you deal with your parents? And I mean, we deal with that here too in a different way.
Yes, exactly.
Boundaries and all of that. It's very real. So I do think what I absolutely love about this is I really think I kind of want to talk about your like redefining of postpartum, because I really think we do spend a lot of time talking about birth and pregnancy. And I know I do. That's why we're here, right? That really is the you focus on these things and it's such a big part of our life. And then but you have that baby and then what happens? And so I think it's so important, because that is our like first step into motherhood and just who we become after we have a baby. And it is defining. And if we don't have the support that we need, or if we don't have the knowledge around how to take care of ourselves postpartum, it's really easy to feel super overwhelmed. And when we don't have to. So can we talk about that a little bit too? And maybe even like bringing your partner into it as well. We talked about the mothers and stuff, but like how do we include our spouses in this? How do we like move forward into motherhood in the best supported way possible?
Oh, those topics, Stephanie, touches my heart. And that I would have to say redefining postpartum, that's my literal mission right now, which is interesting to me because I have been to different conferences over the past year to ask people present because they're all in the field of women's health or related to perinatal health. And you're right. The focus from even clinicians and businesses, startups, investors, there's a lot going on for fertility, for pregnancy itself, and childbirth, and of course, postpartum depression. And this is when I start to realize that when you see even conferences available, when you search just the word postpartum, a lot of depression stuff comes up with it. But I don't like that because to me, postpartum isn't just synonymous with mental health or depression. There's a reason as well why we see the rates climbing, not just in moms, but dads to paternal postpartum depression, is because our view of postpartum itself is not really there. They're really, besides the clinical definition of 6 to 8 weeks after giving birth, there is no actual proper definition. And that's something I've been working on to see whether that needs to go through academia because it needs to be recognized in the academic clinical field as well. So then the change can happen in guidelines and recommendations. And then at the same time, we work with the businesses or I would say non-clinical providers, doulas, nannies, or in the confinement site, we have the yue sao for Mandarin word and pu yue, those who speak Cantonese, and all the postpartum providers, pretty much, midwives, of course, and labor delivery nurses as well. So to me, postpartum is interdisciplinary, it's cross industry, it's mother centered, family focused. I realize the words kind of mean the same thing when we say centered and focused. At the end of the day, we know the mom and the child dyad is hand in hand. We you can't separate that. And that's the nature of how our babies work as well. They just need mom. That's just the way it is. But at the same time, I think when you look at the guidelines and you look at how our clinics approach postpartum, the family is usually not even in the picture. When I say family, I mean our other children. You see blog posts about asking, so how do I get my pet to assimilate? Your pet's part of the family. And our partners, our spouses, they are nowhere in the picture. They don't even have a wellness checkup. They don't even get an Edinburgh Depression Scale test, which is actually designed for women in postpartum. There is no check for the non-birthing partners at all, which to me, it defeats, I think, the purpose of providing full care at the time. But I can't fully blame my clinical peers either because that's literally what we're taught in medical school. And even when I ask my peers in Australia and the UK, especially those who do primary care, family medicine, the general practitioners, even for those who further specialize into family type care or perinatal, there isn't enough in the training. So I think for me, I see similar issues in menopause, not enough teaching and training for not just clinicians, but just everyone in general. I feel that's the same in postpartum. We don't really know enough about that time to even tell our clinicians, hey, here's how you can provide better care. Not only that, we know when we go see our doctors or even nurse practitioners, get 15, 20 minutes? I mean, we were hoping nurse practitioners could fill the gap of care, especially, give more quality time. But end of the day, the entire system is not designed to really provide, I would say, good quality patient time. And that is across the world, to be honest, because having worked in Australia, we always run over clinic time. And because we want, all the doctors want to spend the time with patients, but we're literally not allowed to because of hospital policies, the way the schedule is set up, and the type of what we call metrics that we're expected to tick the box to show proficiency or efficiency. It doesn't jive with what patients want from the health providers, and it also doesn't jive with how health providers want to practice medicine. So to me, yeah, long story short is postpartum is complex, I would say, but it's not difficult. We really just need to work with each other across different fields, clinical, non-clinical. We need to work with businesses. We need scientists. We need industry as well involved to really provide the full care and the full picture. And this is where, so a lot of the past few years when we were stationed in Germany, I just do most of my work in the volunteer side because that was kind of the easiest way to get things done. So I volunteered at the library to do like postpartum workshops. I go to that. We have a new parent support program on base. So I just do my best to mostly give them information so then they can disseminate that across the board. And there is also what they call a family advocacy program, where this is where we need our partners and spouses and non-birthing parents, especially the men, they need to lead the way in making a space for themselves. And that's the hard work. I would say that as a woman and as, a mother, I always invite my husband along, and he has always shown up to all of the appointments. That also means that his unit commander had to give him the time to leave for the appointment. So it really takes a whole effort. So the employers, the bosses, have to also allow the male spouses or non-birthing parents to leave and go to the appointments. And then, the doctor's office and the nurses and midwives and everyone also needs to remember to ask a question to the non-birthing partner and say, so how you doing? How's all this? Especially the first-time parents, especially that. And to ask them, can the clinics come up with their own program to include partners in all the antenatal visits? I think they should. But again, clinics are already full up with all of the things they need to do. Can our associations, especially in the US, or the OBGYN or pediatric or whoever it is, the authorities, can they come up with guidelines? I think they should, to say, start including, a wellness check for the non-birthing partner at antenatal checkups. But we know that takes time. And I read somewhere recently, it's on LinkedIn, someone posted a academic article. Apparently it takes, 17 years or something for evidence to translate into actual changes in clinical practice. And that's just how that world works, which is why I have kind of stepped out, because being in it before, both in the academia science side and clinical side, is just too slow. So coming out of that world, trying to do things and like talking to you, coming on podcasts and working together this way is one of the fastest way to get information out there and to encourage like your listeners. You have to invite yourself into these spaces, because waiting for the system to change is it's just going to take way too long.
Yeah, I think you said that perfectly. And I think that has been my beef all along. And I'm sure it is everyone's beef once they start realizing that that's what's happening. So it is so frustrating, because you're like, you have all the evidence right here, and not just the clinical evidence like you're talking about, or this evidence-based stuff that we have, but like you have moms telling you like, this isn't working and we need to do it this way, or this is working and look at how well it works. Why aren't we, adding that into the practice? And we don't see that. So 17 years, I didn't realize it was that long, but it makes sense. And it is too long when we are trying to do good things for families.
It is too long. And, even I might add, so right now I'm working with a sleep medicine doctor in Frankfurt, and his passion has been to push for better sleep quality in perinatal health, or during your pregnancy, and also in the postpartum side. And he is, this man has got hundreds of, scientific papers published. He's got patents. He's got, his name is Dr. Hartmut Schneider. Those who are interested, he runs the American Sleep Clinic in Frankfurt. And he's also affiliated with the Johns Hopkins University. And he has done so much work. He's treated so many pregnant women for snoring, which I unfortunately actually, looking back, I definitely had sleep apnea that was induced by pregnancy. I don't fit the bill of someone with sleep apnea, not at all. So the fact that my sleep study showed up almost 30 apnea episodes per hour in my sleep. So pretty much every hour of my sleep, I stopped breathing for like 30 times. Probably why I was so tired in my postpartum and during my whole pregnancy. And maybe that's why I developed, gestational hypertension in my first pregnancy. And maybe that's why I got gestational diabetes in my second pregnancy, because I didn't really have as many risk factors for them. But all to bring up that he's been doing this work for 2+ decades. And for someone of his influence and specialty, he's still finding it difficult to push for the change. You know, like you said, it's in the evidence. It obviously there's something there. And for me to think, wow, if someone of his capability is finding it hard, what are the chances of those of us who are not even me and you, but the regular mom and the regular dad? So I try not to get too sad by that. So it does sound sad when you hear this, but then again, that's why you are here. That's why I'm here. And those of you who are listening to this, even for you to stand up to your own health provider and say, this is what I want, this is what I need, even if you have to print things out and bring things to your health provider, then that's what you have to do. And I would say that we are, at this point, a lot of clinicians, not just doctors, but everyone in the clinical world, so your physical therapists, your nurse, your midwives, we all realize that the health system is just really not set up for a lot of us to thrive on both sides, the patient side and the provider side. So you'll be surprised that your health providers will actually say, wow, thank you for sharing this with me. I actually didn't know. There are more of us coming out to be comfortable to say, we didn't learn this in medical training. And so definitely don't be afraid to bring information that you have. And if you do feel that your health provider blows you off or something, always seek a second opinion or a third opinion. I think I don't, this is my personal opinion, I don't classify that as so-called doctor shopping. I mean, we actually reserve that term for substance abuse, seeking behavior, where they go, quote unquote, doctor shopping to procure, medication. But if you are really not feeling like someone is listening to you or helping you figure out what you need for your health, it's always worth looking for another doctor. Just like our, the women in menopause, they are now starting to try and really find for health providers who really understand that. And I would also touch menopause in the sense that there are a lot of us who are having kids at an older age. And sometimes your postpartum symptoms or your postpartum journey and healing and recovery could clash with perimenopause because that age group is there and that late 30s kind of thing. So that's also something to keep in mind as you're going through postpartum, 6 months in, a year in, and to find a specialist who can tackle that. I would say not many, but more health providers are taking interest. And this is where I would encourage, if someone's not quite helping you the way you think, works for you, it's always worth looking for someone else.
Yeah, now you're on my soapbox. That's my thing. Go interview several providers, go find the one that's going to work for you. The thing that gets me is, well, I don't know. I think we put everybody on a pedestal, if they've got the white coat on. But then too, like, the thing I want to get across is you can go to one provider and they can tell you to do something or not do something. And they can claim it's because it's the safety of this, or you're going to do this terrible thing to your baby, or it's not, they kind of like run you down this laundry list of like why this is a good or bad decision. But you go to another provider and they don't say any of that. And they tell you that you're safe and your baby's safe. And so that's where I get so frustrated, is I'm like, so then if you're really looking at it, it is a matter of personal opinion at that point. So it matters that you are with a provider, that you guys are on the same page, that you feel like you can trust and that you can tell them all the things that are going on with you or thoughts that you're having and get good feedback, rather than feeling like you're being bullied or coerced into something, or you're just not on the same page. Like, you see things differently, and that's okay too. But you don't want to have to battle that person, especially when we're talking about birth and postpartum and stuff. You want to feel like you are safe and that person is part of your support team, and to understand that you're hiring them. That this is a paid person that you're asking to be in your space.
And this is where it gets, I got to choose my words carefully here in terms of, I was going to say this gets tricky, but when I say tricky, what it means that on the health provider side, so at least I can give you some insight into this, we have so many guidelines and so many recommendations by associations. But we also know, those of us in practice, well, at least in Australia, I'm sure they have this in the US, it's kind of a thing all clinicians have to do. You have your own department, like education days, or like every week. For my department, we had like what we call a journal club. Sounds fancy, like you journaling, but no, it's a completely different thing. Every week someone has to go look up like what's the latest in our field. So depending on your department, you will go look up, and then you got to read through the paper. You've got to what we call critically appraise the information, and then you got to discuss it in the group. And it gets taken quite seriously, because there's always a question of, can we do better for our patients, or do we change our practice, or is there a new guideline, new recommendation that might say, hey, actually, don't do this anymore, do something else. We want to learn all the time, and that's what that teaching or learning session or peer learning session is. So that's where I would say sometimes we find these amazing studies and go like, wow, I think based on this, I'm going to use the snoring thing as an example, just because I'm deep in working on that as well. There's this Australian professor. He's the guy who invented the CPAP machine that helps, with the sleep apnea breathing at home. And he has been doing so much work in snoring or sleep disordered breathing or upper airway obstruction in pregnancy for almost 20 years. And he's published so many papers on that. And for me to come across this, well, even now I'm looking at this and I'm like, this is not shoddy study. And of course, you do need a science background to be able to critique the paper, because we have to even understand how they do things with the method to then assess, is this a good quality study or not? Because it's very easy, unfortunately, now to also publish because of a lot of unscrupulous journals. But that's a story for another day. So then I asked the question to Dr. Schneider. I said, wow, we've got so much evidence. Like, why wasn't I screened for upper airway, blockage? Because when you think about it, baby pushes up on your chest and everything. It reduces what we say the volume of your chest space. So the snoring, the everything. And, for those of you who got all the swelling in your nose, I got all that stuff. It was hard to breathe when I was, the second, third trimester for me. And the question was, well, this is where we have all the science, but does it translate into recommendations? And I would say it takes the effort of the authorities, the associations to come on board to do something like that. So this is why, so you're right. It is very frustrating, especially when you're deep into doing all of these things. And that's why I'm always a huge supporter of, as frustrating as it is from a clinician side, from an academic side, or even from your side, and then from parents themselves, we all still have to come together and have the conversation, even if at times we're all angry at each other. And I'm not going to lie, sometimes when I see some things on social media or, someone's talking about something and I'm just like, oh my gosh, why? Not everything is clear cut black and white. There's grays and there are nuances to everything. But this is where I think is important, even at times when sometimes we're frustrated with each other or not jiving with, health providers or things. It's still important to still come and have a conversation, because you're right, personal opinions do get in the way, and that's everybody.
Yeah, absolutely. Okay, can I bring this back, just kind of back to the postpartum stuff? I know that's something you talk about in the book, and I think it would be awesome to just chat about here. And you even kind of mentioned it a bit in what you talked about with your introduction. But can we talk about kind of traditional postpartum care versus what we see in our Western world, and what you would prioritize, or how we can kind of combine those two?
Absolutely. So in the modern side, especially, I'm going to focus on the US because, of course, your audience are American based. In Europe, policies are in place to kind of allow people time to rest and do things they need to do during this time. But in the US, unfortunately, you don't have things like 3-month, guaranteed maternity leave or things like that. Although I would say in the military, they do have now 12 weeks of parental leave, both sides. you get that, which is awesome. So what happens mostly in postpartum care is, when you're cleared to go home from the hospital or you have a home birth, then that's it, right? And then you go back for your 6-week or 8-week checkup, assuming it's mostly an uncomplicated birth, then 6-week checkup. And then you probably get screened for your for the Edinburgh Depression Scale to see if you've got postpartum depression, and then you get screened for that at every infant wellness checkup. But do they actually take action on those scores? My personal experience was not really. It was more like a checklist, to be honest. And in the US, that's kind of what you see in the US, and that's why people hire doulas, what they call it, newborn care specialists or nannies, or I know certain communities, they will hire the USL because those women come and stay for the full month and they do everything. And I know not every family can afford that. Of course, it's a resource and a funding challenge as well. So with regards to how this more traditional practice, I would say, can complement postpartum care is, I actually feel like my experience doing the 30 days, it was almost like a childbirth, recovery program. That was my public health brain kind of coming in. I'm like, this is a nice little buffer from the modern side. And even in Europe, it's similar. Yes, they have the policies in place that allow you to rest at home, but it's not like the government also provides you with home help for, the entire month or so. You still have to source that yourself or do it yourself because they expect you, well, I guess you're at home now, so just do everything yourself. But that's not the point, right? Because we still need to rest and heal during the time after giving birth. So this is where I feel this practice really comes nicely in to complement and buffer this time between birth and your 6 to 8 week checkup. Of course, those who can afford to have, the doula or the nanny for a lot longer time, then of course that's even better. And for me, the struggle I have when I tell people this is a great thing to do is, I know not everyone can afford it, both monetary wise or even time. Because if you, in the US, you can scrounge or your leave for, 12 weeks. But can your partner do that even for a month? Because if you are going to cook at home and try to rest at the same time and look after the newborn, that just doesn't work. You really need someone to offload a lot of the tasks, the home, work and everything. And so when I think about this month of rest during the confinement period, the key things to do is nutrition, of course. And I know that is something that you provide a lot of support with as well. And all the doulas do as well. Because I actually did the postpartum doula training with Kappa because I was curious, what is this area? And of course, the best way to find out was to go do a certificate to learn more about the scope of practice of a doula and everything. So that was great for me to learn what, the doulas were doing in that aspect. So, of course, no one expects the doulas to be like a nutritionist or, expert or anything, but enough to provide decent meals for, the mom during the recovery time, during her healing time. So nutrition's important, rest is important, and rest doesn't just mean like bed rest, because we know, this has been proven time and time again, is bed rest for too long does decondition your muscles. And as well, there's, worries about blood clots in the leg, that's why when even when you're traveling on long flights, they always say, oh, try to get up and walk or wear compression stockings. So it's that same concept. But rest just means that you're not stressing yourself out too much with doing chores at home or mental stress. And which just means that you're project managing things at home, like, oh, I've got this appointment, I've got to. So if you had someone to take all those load off for you, then you're truly resting, because then you can focus on giving what your baby needs. So, and this is where I think, and again, this is not a science thing, but when my own experience of breastfeeding and listening to what my lactation consultant has advised me, they're like, oh, you try to relax. And I'm like, I cannot relax because I got so much going on at home. So I don't know if my milk supply, I felt might have been affected on times when I was extra stressed compared to when I was more relaxed. So that's where, again, confinement is nutrition, rest, and those are the key concepts. And so in my book, I do recommend, if the most basic of all basic things you can do is if you can just feed yourself well, and where possible, try to lessen the mental load and physical load of carrying the home, which is what most of us women do anyway. At least then you get a chance to recover somewhat, because we know once that baby hits, second, third month, and they start all their milestones and all the sleep regressions, oh my gosh, yeah. This rest time is so important, right? To recuperate from the pregnancy, from the birth, to prepare you for the rest of this postpartum journey. You absolutely need that. And I can right now only foresee those who have money can afford to rest, to be frank. And I know childcare is, of course, a huge problem in the US, the cost of childcare. And if you are growing your family, that puts a huge extra strain on the family. Then can you afford? And this is where, at least I feel, in the military, at least they got 12 weeks off. So the spouse can be at home, and assuming that the birthing, person, and the woman herself is able to get leave, because she could be working somewhere that doesn't afford her 12 weeks. So yeah, that's my take on it. I know it sounds grim. And of course, I know elections just happened, so we'll need to see what new policies come up as well, whether in support of or not of families. And this is where I would encourage families, look for help all around you, and do your best to get creative with how you are going to approach your rest. And if a traditional practice doesn't make sense for, when I say traditional as a cultural type practice, doesn't make sense for your situation, then it's okay to take parts of it that you can do. I do want to bring up something that could be a can of worms. I know cultural appropriation is quite a strong thing in the US as well, to be honest. I want to reassure, again, this is my own personal take, that if something from this confinement practice makes sense for you, but not the rest of it because of resources, time, all these things, it's okay for you to do just those parts. It's not appropriation. You're not stealing from my culture or an Asian culture. I have to say this. Some people might shoot me down for this, but I just want to be brave and say this out there, because I don't want, I guess, your listeners to feel like, oh, if I can't do it, properly and this way, then I shouldn't do it at all. Because if some parts of it helps you focus on resting and focus on healing, then I think the goal is met, because that's the purpose of this cultural practice anyway, is to help the mom rest and heal.
Yeah, no, I appreciate that very much, because I think anything that's going to help moms rest and relax and enjoy that first stage of motherhood, and really, focus on their baby and their bodies during that time. I think that that's wonderful. I couldn't agree more. I'm curious about the confinement period here. So you kind of talked about, it's Postpartum 30 is the name of the book. So, and we've been talking about this 30 days. So I assume that's kind of the confinement period there. What things can you talk about, some of the things that you incorporate where you kind of like meld those together, and how to utilize the confinement practices with your family, or if not with your family, how would you do that, maybe even by yourself? Because as you were talking and we're like, traditions and this and that, and how people don't have money or time, I'm like, it's such a modern thing that we get married and move away from our family and live all these other places, which is so fun and, all this. But we used to be with our families nearby, so that it was all part of the process that, we have our babies and our parents are right there next to us. We possibly lived on their farm or whatever. And, we had that sense of community, and now we spread out and we don't, it's so much harder. So, but I think what we're talking about too is so important, because I would hope that this generation right now, like for myself, even, I'm like, oh my gosh, I'm going to be the mom that steps up and steps in and makes sure I'm there and can help out and all of that. So I think that we're building it back up, kind of the pendulum swinging the other way in a good way. But those are some of my questions for like the confinement period and doing it with or without family nearby, and what you incorporate.
Absolutely. That ties in so close to my experience, just because, my entire family is back in Malaysia, and then all of my good close friends are in Australia. So when we moved to Alabama, it was like, wow, who do I, thankfully my husband's sister was nearby. And I did make a couple of friends. And this is where I think our experience, of course, being part of, the military community, is you really learn quickly to lean on strangers, so to speak. The typical thing of, oh, it takes time to get to know someone. We don't really have that luxury of getting to know someone. Sure, there is maybe some danger because in Germany as well, it took our time to make friends, and then we got to Germany like month or so before like the hard lockdown and COVID in Germany. So, you're in your bubble. And we decided to stick to our family planning. So we had our second kid. And then when I went into labor, I was like, gosh, who's going to watch our dogs and our, almost 2-year-old? My husband wanted to be in a hospital with me. And I was like, wow. But again, thankfully, we did make some friends quick enough. And so I would encourage, those of us who don't have immediate family for many reasons, because some of us are also estranged from family, and I can understand that, is definitely rely on your friends. Don't be shy to accept help, and even your neighbors. And I feel, again, this is something I feel we don't do enough. You're right. And that modern thing is to actually go get to know your neighbors and, chat to them, or, if you need help from each other. And I think that's important to do. And of course, again, if you have the resources, hiring a doula is very, very helpful, even for a few hours a day, even just to get some things done. Definitely, I would recommend all those meal plans or meal services that can help you during the time, because it feeds not just the mom but the whole family. Because even for my husband, he was the one who, I call him the confinement manny for the second time around. So yeah, he had to do everything at home, of course, because he wanted me to do exactly what I needed to do in confinement, which was just rest and focus on our second baby. But it was exhausting for him, just so exhausting to do everything. And we were glad that our friends stepped in to bring meals and everything, so that he didn't have to just constantly cook all the time, which takes so much effort to be in the kitchen. And I would think in the US as well, there are some communities, very small pockets, who run this thing called time banks. Like, imagine a bank for time, so they call them time banks, or community groups, or your church or something like that, where you could reach out to them for help during that time, even just asking someone to, and engaging a lot of nonprofits is definitely very helpful. And this is where, again, one thing, and you'll probably love this, is postpartum planning needs to happen during antenatal. It cannot happen. It cannot. Birth plans, those are wonderful. But I feel like, and this is my experience having the US side and the German side of care, Germany, nobody cares about the birth plan. But then again, the approach to medicine is very different in Germany. But in US, there was so much care given to the birth plan, which I was like, wow, this is great. But nobody talked to me about my postpartum plan. Nobody talked to me about that. And I was like, why? And I know the doulas are trained to do postpartum planning. I know you've got, your courses on that. But this needs to go into the clinics. This really needs to start during antenatal care. So, and that's where then when the time comes, who do I go to for help? If this happens, or, we know birth can go anyway, that it decides. Like for mine, I was not expecting an emergency C-section at all. But unfortunately, it went that way. But thankfully, I already had some plans in place. And even for my confinement, I was like, okay, great. Now that the C-section happened, I had to check with my Chinese medicine pharmacist in Germany. I'm like, can I still take these herbs? Because now that I had a major surgery, what's different? And then she could advise me. And again, thankfully, in my circle, I have friends who are Chinese medicine doctors. So they knew how to advise me and say, oh, maybe just change this a bit, or I'll write you a new prescription. So for those who want to do this practice as well, I would encourage you to find a Chinese medicine doctor in your area to get on board with your plan, just because medications you might take, especially if you have hypertension or diabetes that require some medicines, to help you manage during the time. It's very important to work with the Chinese medicine doctor or physician, because some herbs could they interact with medications. And there is a lot more growing knowledge in drug-herb interaction. I love that, drug-herb interaction. So it's important to get them on board. So if anything happens, you can call, like both sides know what's going on. And you can still perform your, confinement practice, which ties me to the days, 30 days for me, because that's what all the women in my family did. A lot of the Malays in Malaysia, they do 40 days of confinement, or they call it pantang. And even within Asian cultures, confinement, there's so many, like the Thais might do it a bit differently. The Vietnamese, of course, the Japanese and Korean might do it a bit differently as well. And just a little fun fact, the confinement period documented from the translation from imperial childbirth times in China, it ranged between 3 days to a year. And I tried to dig into who decides what? Because they have 3 days, 7 days, of course, the 30 days, they had the 100 days, and then they have up to a year. And from what that scholarly article kind of surmised was, it really depended on which dynasty was in power and who the imperial doctor was, which was what was promising to me was it showed that, it kind of just depended on the authority, what information was available at the time, and they would make the guideline or the recommendation, so to speak. And of course, as the regular folks in the village, you would always look up to the royal family or what the imperials are doing. So if the doctor says, well, this is it, then they follow, correct? So I thought it was interesting how and that's why again, for me, it's more about what works with us now. We have all our leaves that ties in with our Western calendar. Even all over the world, we use, like our Western calendar. We don't, like in China, even in Malaysia, for our certain festivities, we follow the Chinese lunar calendar. But in terms of our everyday life, we follow the Western calendar. So it makes sense to adapt the practice in terms of days to what fits with your leave. Because 30 days, the first month of my 3 is my confinement, and then I can plan for the next 2 months and go forward. But yeah, I would say that the confinement practice is most effective when you can plan ahead and you can engage your support system around you. It doesn't have to just be family. It can be friends, a neighbor that you know well. Or, I don't know, some of us get close to our babysitters. I have a babysitter in Germany who's now like a family friend, and I go to visit her with the girls just for fun sometimes. And of course, hired help where you're able to afford it. But if you really don't have anyone and you end up having to do a lot of things alone, especially for our military spouses who may be middle of nowhere, just do the most basic thing that you can, and always I would say focus on nutrition, because that's literally what your body needs to heal. And prepare your food, freeze them. The microwave is really not the enemy. Don't, of course, put it on a high setting. Like even till now, I still put it on a lower power, and then cook low and slow, I like to say, rather than just try to nuke your food, because sometimes you just need to use what's around you to give yourself the best chance for healing. So if that means freezing your food in advance, preparing, or occasionally ordering some takeout, that's okay. That's okay. Your body's not going to revenge against you for a couple of takeouts when you really don't have the energy to cook or prepare.
Yeah. So for this confinement period, and you brought up a lot of really great stuff. I know we don't have a ton of time, but I do want to encourage people to, if you have an opportunity, get the book. It's called Postpartum 30, because you go over some other things in there, including massage and different herbs that they can use during this time. And I feel like, and then how to include like family and moms and all of those people. So I feel like it's quick and to the point too. It's not this like big, long, I feel like any mom can read this and get what she needs out of it to be able to utilize this stuff in real time.
Yeah. I did write it from my own perspective, where I just couldn't pay attention, because I wrote this book while I was pregnant with my second child. And I was like, oh my gosh, it's hard enough to read something, let alone write a book. So I purposely wrote it in a way where it doesn't matter where you leave off. It's not like so mentally taxing for you, and you can flip to any chapter and still kind of get something from that chapter without reading the previous one or section one. And I told my publisher, I said, I really want it that way. So when it goes to editing, make sure you tell them that's how it's supposed to read. It's not supposed to be like this fiction on like, like a story kind of thing. So yeah, absolutely. Pick it up, and at your own pace, you can read that. You get something out of it.
Before we jump off though, I wanted to give you a minute to talk about sleep. It's so interesting. You're talking about working with the sleep doctor and what you're doing there. Will you take a moment and talk about that?
Yes, I would love to actually come back for a full thing on that, because there's so much stuff I could bring for you and your listeners.
Yes.
So with sleep, we know that sleep quality is poor in pregnancy for so many reasons we can't control. One is the hormones, your metabolism, everything is just going wonky because everything is trying to help the fetus thrive and you help your baby to grow. So the priority of your body is not mom. Like, the reason my body is keeping me alive is so my baby can grow. It's literally the physiology of the whole thing. So your sleep is bound to be compromised by many things as the pregnancy progresses and baby grows. The baby itself is, the movements and everything that could keep you up. You can't control that. Baby does whatever they want. And then number two is all the other changes in your body, which I briefly mentioned earlier. So our airways we have a certain volume, all of its different shapes and sizes. We have a certain volume, but when you have baby growing, and also for the men who have beer bellies, it pushes the diaphragm, which is the muscle kind of under your, that separates your chest from your abdomen. It pushes up against that. So it kind of reduces the volume in our chest. And that itself can affect like your airways and how floppy or tight it is. And this is explained, very well by Dr. Schneider when he loves to explain all this stuff to everyone. And what happens then is it puts you at risk of snoring, because snoring is when, your airways kind of close or get floppy and then you snore. And not only that, some of us developed, like my whole area here got so swollen from the second trimester onwards. I always felt like I was having a cold or something, but it was just swelling of all the mucous membranes because of hormones. So we have so many things against us that we cannot control in pregnancy that can affect sleep. And I had really bad pelvic girdle pains, had the lightning crotch thing as well. So not great sleep, ended up sleeping on the recliner in the living room for like the whole third trimester. So because of that, whatever sleep you can get needs to be the best sleep possible. And that's why, and I do want to say I'm not paid or anything to push any products, because I know that's a thing in our world out here, podcasting and all that, is if I would give a couple of tips here. Number one, in your pregnancy, if you feel like, I feel like I'm getting my 7 to 8 hours sleep, but I'm still waking up so tired, or I'm waking up with a dry mouth, or I'm just falling asleep in the afternoon, like, that kind of sleep where you're so tired you can't help but fall asleep. That is a sign that you're probably not getting enough air or oxygen at night. And it's worth seeing your OBGYN to say, hey, I'm having these symptoms. Can I get checked out? And the other thing as well is if you have, your partner or spouse, if they start to hear you snore anytime in the pregnancy, definitely go get checked out for sure. Just because as well, this is something with Dr. Schneider's work, he has proven that us women in general have a different sleep and snoring pattern than men. But unfortunately, in the labs, a lot of the settings used to diagnose upper airway obstruction or sleep apnea is just like most things in medicine, using a men's profile. So when us women go in there, or pregnant women go in there, unless you match the pattern of a man in sleep apnea or snoring, there's a chance of underdiagnosis. And then you get told, oh yeah, it's fine, your oxygen's not dropping and all that. So it actually happened to my oxygen didn't really drop very much, but the other things hit the mark, and he was like, yeah, you got sleep apnea. And I was like, dang. So it's important to get that checked out, because we know sleep is very it's crucial to your brain health and your entire body function. That's why when we get educated about sleep apnea, you get said, we're told that, if you don't get enough sleep, you're snoring too much in sleep, you don't get enough air, your heart health is a problem, your metabolism gets wrecked, your mental health, then the way you cope with stress, like everything just falls apart. That is very true. And so that's why even more so in pregnancy, it's important, if you notice these things, go and get checked. And hopefully then they can help you either depending on what the sleep study result says. Not everyone needs the machine, but if you do need the machine, it's so non-invasive and it's temporary, because you would expect after we give birth and everything kind of peters itself out, then you don't snore and you don't have the issue anymore. Unfortunately, I didn't. 2 years plus, I still had the issue, but mine's a whole different case, altogether. But, just like with eclampsia, preeclampsia, like the so-called treatment for that is to deliver the baby, right? Because then our body starts to, go back to its pre-pregnancy state. So just to reassure you, in the realm of sleep, the type of treatments available for sleep disruptions or opening up your airways is completely non-invasive. There is no medication involved, and it's only temporary, that to get you through this and to give you a comfortable pregnancy, energy during pregnancy, which I think is so important. And maybe, which we don't know, and that's the research we're aiming to try and start doing next year, is to find out how much of this sleep disruptions or snoring affects like the blood pressure and the diabetes. So if we do find something interesting there, that will be quite groundbreaking. So I'll keep you in the loop on that.
Yeah, that's so neat. And I know sleep is that's a constant discussion, right? And we all kind of jokingly talk about it in third trimester. And so I'm glad that you kind of gave some information here so that moms can go get help if they need it. Because yes, we're exhausted enough with growing a baby, let alone not sleeping well. So I appreciate that. But for those who are listening, Dr. Lau is being so kind as to give away one of her books, Postpartum 30. So if you would like to enter into that, and we will send one to you, you will find the Pregnancy and Birth Made Easy podcast on Apple Podcasts. Scroll to the bottom, click write a review, hit the stars, write a review, screenshot your review, and send it to hello@myessentialbirth.com. And we'll get you entered. And then we will, I'll announce that Monday, the week after this goes live. So before we leave though, Dr. Lau, will you let everybody know where our listeners can find you?
Absolutely. Find me best on my website. It's www.bridgesinhealth.com. And Instagram, my handle is @mamaswingwoman.
I love it.
I laugh just because it's my husband's in Army aviation. So I was like, oh, wing woman. All right, let's go with that.
I love it. Well, thank you so much for being here today. Thank you for all the work that you're doing, because I'm so excited. It's just going to keep growing and going, and you're helping women everywhere. So thank you for everything that you do.
Thank you. Thank you for your support.
If you loved what you heard today, the very best way to support this podcast and help other moms to find it is to leave a quick review. I read one at the beginning of the episodes, and I would love for yours to be next. And if you're ready for even more pregnancy, birth, and postpartum goodness, come join me in the My Essential Birth course at myessentialbirth.com, where I will hold your hand and walk you through pregnancy and birth step by step, so you're totally prepared for a birth you'll love. See you next week.